Hi, I'm Dr. Brad Dunlap, orthopedic surgeon and sports medicine specialist. Today, we're going to talk about the ACL, or anterior cruciate ligament. The ACL is one of the four main ligaments in the knee. Together with the medial collateral and lateral collateral ligament, the anterior and posterior cruciate ligaments are responsible for the stability of your knee. Now, you probably have heard of people who have torn their ACL, and maybe you've even injured it yourself. Most commonly, it's a non-contact injury, an awkward fall or landing, though it can occur in a variety of different ways. Unfortunately, the ACL does not heal itself. Without an ACL, you can typically do your day-to-day activities, walking, even some straight-ahead running. However, with an ACL deficient knee, you may notice that your knee buckles or gives out with higher level activities such as cutting, pivoting, or jumping type sports. If you've torn your ACL and desire to get back to a high level of activity, you may need to consider surgical reconstruction. Today, let's go through an ACL reconstruction surgery.
Okay, so here we are in the knee, looking at the kneecap above us. This is all done under fluid. You'll see some air bubbles floating around. This is the medial meniscus or shock absorber on the inside part. That looks fine as well. Here we are in the middle of the knee. This is what is left of the ACL. Just a thin fiber. This is what an ACL should look like, a picture from a different patient. Nice thick structure. And here you can see a thin structure. On the top left, there's that open area, a so-called empty lateral wall sign. No ACL fibers going there, and this is what a torn ACL looks like. The lateral part of the knee, the lateral meniscus, looks fine. The cartilage surfaces also look fine in this patient. So what we'll do here is open up that middle of the knee, open the bone up, perform a notchplasty. The PCL, the posterior cruciate ligament, is to the right of us. And then we start to drill our tunnels. This is our femoral tunnel that we'll drill. We need to have space to feed our new ACL graft. And we use this drill that's the same size as the tendons that we're going to use as our ACL graft. So you can see this nicely clears out the bone and creates the ACL tunnel on the femoral side. And now we will feed this straw into that tunnel and retrieve it so we can later pass our graft up across. You can see into the tunnel there, we've removed the bone, and that graft will fit nicely into that tunnel. Now we will drill the tibial side. We use our guide to get it right where the native ACL should be coming in. And we have our guide pin here that we drill up into the joint. You can see the PCL behind it. And now we have our appropriately sized drill to open that tibial space up so that it also matches our ACL graft. Now we'll retrieve this suture across both tunnels so we have an idea where that ACL is laying. Again, the PCL is sitting right behind it. Now we will pass this metal button up across the tunnels, and it will come and sit outside the lateral femoral condyle. And here is our ACL graft. In this patient, these are hamstring tendons. There's many options you can use for ACL graft. You can see as we snug this graft up into the femoral tunnel, it's a nice fit, nice snug fit, which is good for healing. We will then put a screw in the tibial side to secure it, and here you can see our final ACL graft. So the PCL to the right, there's plenty of room for our new ACL graft, and this is our final ACL graft. A post-operative x-ray shows our final implants with that metal button on the outside of the femur.
Post-operatively, patients are typically on crutches for 7 to 10 days and can bear some weight. They'll use a brace for about 4 to 6 weeks after surgery, and physical therapy will start a few days after surgery, and it will continue for several months, working on progressive sport-specific exercises. Full return to all activities and sports is closer to 8 to 12 months.